Hello everyone, and today again I'm very excited to have a ranker along with me, Dr. Sowmya. Heartiest congratulations, Dr. Sowmya.
Thank you so much, ma'am.
And first of all, I would like you to introduce yourself.
Hello, everyone. I'm Dr. Sowmya. I finished my MBBS from Lady Hardinge Medical College, and I've secured a rank of 130 in INI-CET July 2021.
All right. So, how are you feeling now? Because this year it has been very different. It's not just the academic knowledge, it was also a test of your patience, your consistency. So, what do you feel that how was it different from the other years?
Ma'am, I'm on cloud nine. I'm very elated. Ma'am, absolutely, you're correct. It's been a very exceptional year in every aspect, not just in terms of this exam, but in every single aspect. It's been an exceptional year. So this year has been more about being consistent. It's more about being disciplined rather than being the smartest person or the most intelligent person. So it's actually challenging your patience, as you rightly put it. So it was more about just keep studying, no matter even if it's for 3 hours or 4 hours. Just keep studying. Just make sure that the car is running. So that was very rightly said.
Yes, I mean, I felt that this year told everybody what's the importance of plan B in your life. When plan A is not going on, you should always have plan B ready because it was a most unpredictable year.
Yeah.
When your exams were getting postponed, you were not having the face-to-face classes, and you were not having any certainty. Then there was a lot of pandemic, a lot of sickness, and we were like kind of negativity all around.
Yes,
So
ma'am.
what do you feel, how did you kept yourself motivated in so much of negativity that helped you in coming out with this amazing score?
Ma'am, first of all, I mean, as you said, like it was challenging for everyone, but then somehow I kept myself motivated by because thanks to I had a really good set of friends, so we all motivate each other. We would all April and May was specifically very difficult for everyone because the pandemic was at its peak. So all of us would somehow will motivate each other. We will like if I study for 2 hours, my friend would get motivated. Then she'll also study for 2 hours, 3 hours, and that's how we would motivate one another. And of course, I had my parents were very supportive. My entire extended family was very supportive, and even like this has been our dream for so long. So it is our job that we safeguard it and protect it. So I would always motivate myself that you worked so hard, because it's not just a matter of the last 1 year that we studied in internship, but our entire effort, our entire MBBS 5, 6 years. So I always used to tell myself that no, you've done so much, you can do it for the next 1 or 2 months, and somewhere that feeling that the country really needs doctors right now. If we're not able to work in the field, then at least what we can do right now is that we can study so that we can get back working. That was also another motivation that like the country needs doctors, the country needs you. If you want to help the country in any way, it would be to just study. So these were all the things that were running on in my mind. But yes, definitely there were many setbacks that happened. First, postponed, their names got postponed, and April, May were very difficult. We were all facing a lot of challenges, and but थोड़ा करके एक दिन में probably we were not 8 hours or 10 hours, but even if it's for 2 hours, even if it's for 3 hours, I think we should all congratulate ourselves and pat ourselves on the back, because उन दिनों में उतना करना भी बहुत मुश्किल लगता था. तो
बिल्कुल. So I think a very good thing and awesome example you have given me, because every time you are not able to give the same, but maintaining the pace and to go on is the biggest thing at that time. And of course the role of family and the friends always comes first. So if you have good family and good friends with a lot of positivity, I think you are the most blessed person, because everybody spreads negativity. To cut that negativity and bring that one ray of positivity is the biggest thing, even in the hardest of the parts. So that's what I try to do every day. Yes. So okay, Sowmya, so let's talk about your academic tour. You were our foundation batch student, so how did you started and how did you feel that preparing right from the beginning, from the foundation batch itself? How is it beneficial, and is it worthwhile to start early?
Yes, ma'am. I joined Bhatia in my third year as a foundation as a foundation math student, and I am very very happy that I took that decision. One of the best things about Bhatia that I've seen is that they've always focused on concept based teaching. So and I really like that style of teaching. We had a demo class in our second year. Sir had come and he had taught us, and I really liked the style of teaching. So me and my group of friends, we all joined DBMCI, and I remember it used to be a very interactive session. So it's like our teachers used to ask us the questions pucho, and we used
Yes.
and that is the sort of teaching that and that's the sort of teaching that stays in our 4 years together.
Right.
Remember, they used to ask questions, we used to give the wrong answers. Those wrong answers and the teachings is what stayed with us in internship. So I really liked the style of teaching. I mean, be it Rajat sir or be it Jay Arora sir, or all the teachers, not just these two teachers. All the teachers have always concentrated on concept based teaching. Even you, ma'am, you also always focus on on conceptual teaching. All of this you made Squint and all of these difficult neuro-ophthalmology so easy by showing us the concepts. So and it's always been very simple. Like just keep it very simple, keep it very basic, and that's more than enough to get yourself going. So another added advantage that I found in my third year is that we were taught the final year subjects, and I joined the weekend class. So every weekend we will study and we'll make notes, and the next we'll have a test. We'll have a test series. It'll be a small test of like 20-30 questions. It'll be like a test so that they make sure that we study. So that was a good initiative that I really liked. That weekly test we would get, and we would study for it. Like throughout the week, I would study for it, and then on the day of the test, even if I don't study for it, I give the test and I make sure that something you'll recall, something will stay in your brain. You'll make a mistake, stay in your brain. So you're like sort of consolidating those concepts. So in my third year, that I think that was the best decision that I took, is that I joined DBMCI, and because the teachers encouraged us to ask so many questions, I also asked a lot of questions, and that really cleared my concepts. And those questions are what I remember till the end of my internship. Yes, I would definitely advise everyone to join to join early on in the preparation. Third year would be ideal, and to make notes, and most importantly, read the notes after coming back. I mean, I did not do it for all the subjects, but for the subjects in which I came back to my hostel room and studied, those are the subjects that are my strong subjects today. जिससे मैंने रिवाइज नहीं किया होगा वो अभी भी थोड़े से वीक है. So I had to compensate in my internship year. So if you're a third year student and if you're watching this, then please, once you're reading this, once you're done with your entire class, you please go home and you revise it. That makes a huge difference. It makes a huge difference to your performance.
I think आज मेरे students will realize that why I always bang upon ki please to read today and come back in the other class after reading only, because it's always say that if you are reading and revising on the same day, it's 100% you are getting back. But if you are even missing by one day, you will be left only with 50%, and then other day only 25%. And if you are not reading it for 4 to 5 days, you are back to the square one.
Yes,
so that is amazing thing. Good to go that yes, a student is also realizing the same. You should always, I know it's a tough thing when you are having 10 hours class or maybe whole day class, then I say please go back, read, and then come again. I feel that I'm doing like torturing these students, but actually it helps a lot because us samay fresh hota hai, and if you are going through it, that always helps. Okay. All right, then how did you started giving grand test? Were you punctual, regular in test?
Yes, ma'am. I started giving grand tests in March 2020, and I used to give it 2 weekly basis, and I would like on the test press site we and in those days, like I would do GT because I used to like solving questions. So I used to really enjoy doing the GTs. It used to be like a very comprehensive way of revising. So even though I was not scoring well initially, even though I had not finished the subjects, but I would just keep on giving it because I'll get an idea कि हाँ ये important topic है, ये पढ़ना है, ऐसे पढ़ना है. So it's just something that and you also get into the practice of giving a GT of managing the time. So since I've been giving it since March, it's been easy for me to manage the time. I've never had panic. I've never found the need in the GTs. So that I would recommend everyone to start giving GTs as soon as first few GTs. It's okay if you don't do well, but still, just give GTs. Just keep it going.
So you gave I think after 15 days, every 15 days you give the GT.
Ma'am, I would try to give it like every 2 weeks. Sometimes it would be like 1 week here and there, but the GT schedule, we had a GT schedule, so that's what kept me on my toes. So somewhere I'll have a reminder ki haan, is hafte GT hai. So
you were happy with this, or do you think that you need to give it more frequently, or is it fine? Good to go with the 2 weekly.
Ma'am, like in my internship period, I think 2 weekly was adequate because we had duties and we had everything. And at that point of time, we were also we were also growing at a very slow rate. Like we were device as fast as we are right now. So those days, I think 2 weekly is fine. But as and when you're done with one revision, then I think you can do it on like a weekly basis.
Weekly also.
Or even 10 days, like even 10 days you can give the GT, but you should give it regularly. You should be in constant touch. Towards the end, yes, you should give it more frequently.
What do you think reviewing of a GT is how much important?
I think it's really important because to make those 3 hours worth it, you should actually review the GTs.
Exactly.
For your weak areas, you'll get to know you'll get to all the areas from which they're asking a lot of questions. So it's also a way of revising your notes. If you look at it, GT should always be seen as a way of you're reviewing it of revision rather than seeing it as a way of assessing yourself. I would always see it as another revision. Probably the rank won't be good, but I would not care. I'm like, no, it's a way of revision. Right now I'm in the learning stage. I want to revise.
Exactly. Test is also a learning tool. Don't take it just as an assessing tool. And that is why most of the students say that we will give the test only when we are complete with the 19 subjects. I think this is a great mistake which they are doing. And as you rightly said, you all are in learning phase. So you can get plus or minus, but you should learn from it. That is the most important thing.
Yes, ma'am.
Yes. What do you think? You must have given the mock test also. So were they actually simulating the environment as well as academics? Were they able to give you a real and complete idea how you will be having the real exam?
Ma'am, yes, ma'am. I think all mock tests you should the purpose of a mock test, as ma'am correctly said, more than anything, don't use it as a tool to assess yourself. Rather see it as a way to make a strategy. So all it is a simulation only of what is really going to happen in the real exam. Like from the format, everything from the format till the time, everything is going to be, even questions, they'll all be of the same format. If you look at our team of teachers or our team of doctors, they've all been in this line for so many years, so they know the areas from which they they like asking questions. So accordingly, they make the questions. Accordingly, you know that this is an important topic. This is not an important topic. You'll also get better with time management. You'll know how to manage your time. Okay, I have 3 hours. First hour, I should do this many questions. Second hour, I should do this many questions. I want the last 25 minutes to be for my own revision. So these are all the skills that you'll only develop if you give mock tests. So I think mock tests are definitely a yes, and you should start giving it, and they're very useful and you can learn a lot from them. It's just it's a recap of the entire syllabus.
And Sowmya, you were talking about a vibe session also. Yes. So how did it help?
Ma'am, I joined the May 2020 vibe session, and it really helped me because I was revising. It really helped me towards the end of your preparation. When you're done with your revision and you want to do a quick recap of everything, because in the last 2 weeks, in the last 1 week, you just want something that is very high yielding, that takes less time. You don't want anything that is going to take too much of your time. You just want it to be very crisp. You want it to be very precise. You want it to be very focused, and that's where vibe helped me. And all subjects were covered beautifully. Ashwini sir had covered all the very high yielding cadaveric images. Likewise, ophthalmology was superb. I remember, for ophthalmology, that was the main thing for me. I used it that was the main base for me in the vibe session. So I found it very useful. You had included instruments, you had included all the tests. And nowadays in ophthalmology, more than asking the hi-fi things, they're asking the clinical, practical. Yes. see every day in your OPD. So all of those things were included. Even in surgery, all the instruments, all the recent advances, all of those were being used. So it covers everything. It's like touching everything, and you can finish it within a very short period of time. So it's and it takes less time. So I would definitely recommend people to see the Vibe video. You get a book.
I think it's kind of a mini revision that you could do in a very small amount of time, and visual memory always lasts long. So
Definitely.
when you are looking at images, whole of the topic, quickly swipes in your mind, and you are, fresh with the knowledge of all those things. Yes.
Yes.
Sowmya, tell me one thing. Like you told me that more of clinics are being asked nowadays, and we are seeing a pattern which is quite changing. Like I think from year 18, 19, 20 was a very different paper, and 21 INI-CET, and we are expecting a very, very different kind of a paper in the NEET PG 21 also. What do you think the amount of the data, the academics that we are providing, the concepts that we are providing are, sufficient for this, or do we have to go somewhere else also and, fortify it? What do you think?
Ma'am, definitely, like as I said, like from the very beginning, even before this new pattern of NEET was introduced, we were always taught in the conceptual way. So
Yes.
it was like I joined in 2017 when I was in third year. So since 2018, since then we've always been taught conceptually. So that's why even when this change happened, it was not like a big change for us, because we were always taught in that manner. So I think if it's if students want to do something, then if like the MBBS students, then you make your notes, you revise it, and you keep asking questions. And if you keep asking questions, you go to your clinics, you ask the question, you go to coaching, you ask questions, you just allow to expand your horizon, and concept apne aap build hota jayega. Just be observant wherever you're going, hospitals or even be it in coaching. And of course, our coaching teachers show us a lot of image-based visuals, even in our classroom when we were in third. So come back and just have a quick review, recap at it, look at the image again, try to build your concept. So it's like we have ample information. There's so many resources around you. You just have to build on them.
Yes. I think, concept building now they are laying stress on that. They'll be asking you the clinical scenarios, they'll be asking you concepts, but we had been teaching concepts from the very beginning, and we never promote the rote learning or just, ratifying the things. And that is why that is already, inculcated in us. So, yes. What do you think that any message that you want to give, the do's and don'ts that you have come across from your experience, or something else that you felt, because along with the do's, I think don'ts are also very important in this time, because you end up wasting in time. You have over material this time floating all around, and sometimes the students are misguided and they'll end up wasting their time. So what do you want to say about this?
Ma'am, I'll start with the do's. In fact, I'm very glad that you asked me this question, ma'am, because our batch specifically, since we had so many opportunities to redeem ourselves, like we're supposed to give this exam on May 8th, and then June 16th, and then finally July 22nd. So we had like so many, so we got to learn from each and every postponement. We are also growing with the postponement. Yes, a lot of resentment. Yes, it was very challenging to study for so long, but from each, I saw that from each preparation, I was learning from the previous mistakes. So I've learned a lot from my mistakes. Do's, yes, certainly, as I specified before, if you're an MBBS student who is doing coaching, then go back to your room or home and revise, because it makes a huge difference. And then be persistent with your studies. And ma'am, I would certainly encourage people to engage in the discussions, to ask questions, and to go according, as you said, clinical side, and build on those concepts. Ma'am, one thing that has personally helped me a lot, I feel, is that I attended a few quizzes in my MBBS, just 2-3 quizzes, inter college quizzes I attended in my third year. So that really helped me. I did not win any of them. I did not even make it to the semi-finals, but it really helped to expand.
Winning is always not important. Na? It's the participation that is important.
Yes, ma'am, that is true. So at least it helped me to expand my horizon. So try to expand your horizon. कि हाँ ऐसे भी questions पूछ सकते हैं. So help me in the MBBS stage.
So when you are active now, if you are positive, you will see positivity all around. If you are active, then you will see activity all around. And if you are lazy and you don't want to study, you will see that all around. So it's all the game of your mindset. So I think if you are, why as teachers, we are always asking that please ask us the question, because you cannot ask a blank question. If you are asking a question, that means you have gone through the thing, you have pondered upon it, and then you are applying your knowledge, and then you are asking. That is why I always keep on asking the students, please ask me the question. How matter the silliest question it may be, but I like really that act of that students are asking. So I think that is a very, very important point in the do's. So what about don'ts?
Ma'am, don'ts is, I would say, do not get like discouraged by any rank, be it GT, be it TND, or be it anything. This is like you, as I said before, you should not see it as a way of assessing yourself. You should just see it as realizing. So there have been many times where I thought that I can't do it, but then towards the end, I just wrote something that, and then I stuck it on my wall, that there's hope till that wall. So till
always remember that why did you start it? That will always help you in going forward.
Yes, ma'am. So do not get worried about the GT score or the GT rank or anything. Just keep going. Just keep studying. And ma'am, I'm sure that everyone can reach their dream. And yes, do surround yourself by positive people. That is very important. I kept myself away from the negativity. There was a lot of negativity going on social media, and people saying different things. Yes, it was a challenge for all of us, setback for all of us. But then just surround yourself by positive people who will just push you, and who want you to do well. So that was very important. I had a very good support system in terms of family, friends, and teachers. So in that sense, I think I've been very blessed.
Wow, I mean, it was very nice and positive. I think a very good message and a positivity message from Dr. Sowmya. So any last message that you would like to give to your juniors who are looking upon you as a star and they actually depend upon you, that yes, what is she saying? Anything in special you want to say?
Definitely, ma'am. I would just like to give a message to all juniors that as I said before, just be consistent. Just every day, you just make sure that you're disciplined, be consistent, and just tell yourself that anyone can do it. I mean, anyone can do it because it's doable. बहुत सारे लोग सोचते हैं कि नहीं हमसे नहीं हो पाएगा और पहले ही they give up, but ऐसा नहीं है. Everyone can do it, and just stay hopeful towards the end. There's always hope. I have some juniors messaging me कि it's just 3 months into the TND schedule and there's rank nahi aa raha, wo nahi aa raha. I'm like, don't worry. Till you have so many months ahead of you. Just keep studying and you'll get your rank. Don't let these setbacks throw you off. It doesn't matter. It won't matter. Of course, if you get a good GT score, you'll feel good. But if you're not getting it, then it's okay. There's always going to be another GT in which you'll do better. So I would just advise people to just stay positive and to just keep going. And I wish everyone all the best.
Yes, you can always succeed until you stop trying. So please never stop trying. And nothing is impossible because the word impossible itself says that I am possible. So a very good message from her. Thank you so much. And heartiest congratulations from whole of the team DBMCI.
Thank you so much, ma'am, for the entire DBMCI staff and faculty. All of you have been very, very supportive throughout this journey. It was difficult for you also. You guys have been working on the field also, but you also motivated us throughout the journey. And I'm also very grateful. I had really good teachers, very good mentors. Ma'am, you Dr. Niha, Dr. Rajat sir, Samim sir, Jay sir. The list is endless. Ashwini sir from PSM. There's so many people that Ajay sir from anesthesia, Bharat sir. All of these people have been very, very helpful in their own way. They were always they would always put something on the Telegram group, and that would motivate us. So thank you to the DBMCI team and the supporting staff also, Anu ma'am, Ashish sir. Like from the beginning, if they always took the feedback very they were very receptive
regularly. Yes,
student feedback. So if we had any problem, they would always get back to us. So I'm very grateful to the DBMCI family.
Thank you so much. Thank you.
Thank you, ma'am.